Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Yes, now let's look at the JVP and some deformities. So JVP, as we know, it stands for the jugular venous pressure, and let's look at its waveform. So first we have the A wave, next comes followed by the C wave, next the wave descends, and then we have a X, the wave X, followed by there is a V, then comes the Y. So this is roughly how the JVP looks. Now let's understand each wave and its corresponding abnormalities. So first is A wave. So this A wave is it corresponds to the atrial contraction. So A stands for the atrial contraction. So this atrial contraction. So what are the abnormalities associated with this wave? So abnormalities associated, it includes the prominent A wave. So there is a prominent A wave. Next, there can be a cannon A wave. And lastly, there can be an absent A wave. So what happens in the prominent A wave? The prominent A wave, there is a pulmonary hypertension, or it can be due to the tricuspid stenosis. So prominent airway is the pulmonary hypertension. Next, there is the right atrial thrombus or the mass. Then comes the tricuspid stenosis. Next, when you look at the atrial fibrillation, absent A wave is nothing but it is the condition will be the atrial fibrillation. Then what about cannon A waves? The cannon A waves, it includes a complete AV block. So it is a complete AV block, or it may be due to the VT, that is a ventricular tachycardia, or premature atrial junctional and the ventricular beats. So premature atrial junctional and ventricular beats. So this is all about the A wave. Next we move on, we look at the C wave. So this C wave, it corresponds to the bulging of the tricuspid valve into the right atrium, and this is during the ventricular contraction. So it is basically the bulge of the tricuspid valve. So bulge of the T valve, the tricuspid valve, it is into the right atrium during the ventricular contraction. Next comes the X descent. So this X descent, it corresponds to the atrial relaxation. So it is the atrial relaxation, and the abnormalities, it includes the absence of the X wave, or there can be a rapid descent of the X wave. So what happens in the absent X wave? And next is a rapid X descent. So one, you have the absent X descent, other one is a rapid X descent. So in terms of the absent X descent, it is the severe tricuspid regurgitation. So you have the severe tricuspid regurgitation is completely the absent of the X descent. Or in case the rapid X descent, it refers to the CT. It refers to the CT. There is a cardiac tamponade. So absent X descent is a severe tricuspid regurgitation, and rapid X descent is going to be the cardiac tamponade. Next, we move on to the V wave. So what is the V wave? So the V wave, it corresponds to the venous filling of the right atrium. So it is nothing but the venous filling of the right atrium. This is the V wave. So what is the abnormality here? It is a dominant V wave. The abnormality is there is a dominant V wave. It's going to be the dominant V wave. Dominant V wave, and this is a condition that is a TR. So severe TR, we also saw the absent X descent, and the dominant wave is also the tricuspid regurgitation. Lastly, we look at the Y descent. So what is the Y descent? So in the Y descent, it corresponds to the passive emptying of the right atrium. So emptying of the right atrium, and that too it is going to be passive. So passive emptying of the right atrium into the right ventricle, this is known as the Y descent. So this Y descent, it can be again three categories, that is, it can be prolonged, rapid, or it can be absent. So let's look at these conditions. Prolonged, it can be rapid, or it can be totally absent. So in case of prolonged, it will be the tricuspid stenosis. This is the prolonged Y descent. So tricuspid stenosis. Then in case of absent Y descent, it is going to be the cardiac tamponade. So absent Y descent is going to be the cardiac tamponade. The prolonged Y descent is going to be the tricuspid stenosis. Next, the rapid Y descent is a constrictive pericarditis. The rapid Y descent is going to be the constrictive pericarditis and isolated severe tricuspid regurgitation TR. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.